The 65-year-old's death took the Gibraltar community by surprise last summer, and now we learn how she died. Daphne Alcantara needed surgery to remove a benign tumour from her brain. The surgery was successful, but there were then deficiencies in her aftercare. A post-op thrombosis developed in her sinuses. A series of missed opportunities led to catastrophic brain injury. Daphne was left in a significantly weakened state with hospital-acquired pneumonia and sepsis. In accordance with her own advanced decision, 13 days after her initial surgery, her family asked for life support to be withdrawn, and she died. The cause of death was recorded as unknown and an inquest ordered. Daphne's family submitted that staff at the National Hospital for Neurology and Neurosurgery failed to prescribe and administer appropriate anticoagulation medication to help prevent blood clots, in accordance with a clearly documented plan. They said staff had documented medication as having been given when it had not been given. That staff failed to read and act upon the recommendations of a neuroradiologist, and that they failed to investigate, diagnose and treat the thrombosis in a timely manner. Coroner Dr. Richard Ian Britton set aside 2 days for the matter at the St. Pancras Coroner's Court. Having heard evidence from Daphne's husband Jimmy and from the medical professionals involved, the coroner reached his conclusion after the first day. He said there were multiple missed opportunities to act on imaging, which highlighted this potential diagnosis and also to initiate medication. Dr. Britton concluded that had these opportunities been taken, they would likely have prevented Daphne's death from occurring on the 4th of June. He found that Daphne's thrombosis was not adequately investigated, diagnosed, or treated in a timely manner, and that this reflected a low standard of care, gross failure, neglect. Daphne poured her all into campaigning on behalf of those living with dementia and their families. She believed if we could get dementia care right, there would be significant benefits across the health and care sectors more generally. Faced with a major threat to her own health, Daphne continued to think of and work for others until the end. The night before her brain surgery, she was still dealing with correspondence for the charity that she spearheaded, the Gibraltar Alzheimer's and Dementia Society. Those who worked with Daphne say that she gave so much of herself, but she still had more to give. Their sense of loss is now compounded by the finding that Daphne's death on the 4th of June last year was preventable. Her family told GBC they'll now make a negligence claim against the healthcare provider.